where we are going to be talking about certain interesting topics as well. But for the moment, joining us here in the program is our very distinguished guest. Joining us is Dr.Muhannad Abdulhafiz, who is actually a dentist, and with him we are going to be having a very fruitful discussion pertaining to oral hygiene and as well as the discussion of beautiful smiles. Now, with this, allow us to welcome Dr. Muhannad Abdulhafiz. Assalamu alaikum and good morning, doctor.
Thank you.
Thank you for joining us here in the program. As many of our viewers are always having questions about visiting doctors, about visiting dentists, what is going to happen, what are the things that they are supposed to do. For the ones who cannot afford to regularly go to the dentist, they're always asking as to what it is that we can do to maintain good oral hygiene and nice, pleasant teeth. Now, with this, Dr. Muhannad, we're going to be talking to you about many of the different things under the bracket of those two. But then again, tell us, how important is oral hygiene and why is it that we so very much need to maintain it?
Okay, that's a good question. Actually, oral hygiene is, we can define oral hygiene as it is a practice of cleaning the teeth and keeping them healthy to prevent dental caries, to prevent gingivitis and bad breath. That is the main reason to start oral hygiene, and it is actually a patient rule, or we can personal rule. It is not done by inside the clinic. It is not done by dentist. It is done by the person himself. That's oral hygiene, simply.
Right. Now, with this, doctor, we would also like to know as to what is perhaps the proper plan for a person who's watching us right now to be able to be creating the right plan in order to be having the best oral hygiene.
Okay, so to have oral hygiene, actually, mainly it is cleaning the teeth. That's mainly what they mean when we mention oral hygiene. There are several ways to arrange that. At home, we can cleaning the teeth. Actually, the main thing to do is brushing, tooth brushing. Teeth brushing is to clean the surface of the teeth from outside, from occlusal side and all sides from outside the teeth. This is cleaning. That's brushing. You know that brushing, it should be used about 3 times daily, minimum twice daily. And there is many way of brushes. I will describe that later, how to make a correct brushing way. It is used, I want to mention that it should be done by middle or soft brush, dental brush.
Medium or soft brush? Either a medium brush or a soft brush, but
medium.
Definitely not a hard one.
No, not hard. And when you brush, you should brush thoroughly and gently. Don't brush too much. That's what damage the tooth also.
So how long should we brush the teeth for?
Excuse me?
How long should we brush our teeth? Each session
actually, each session, it is according to different aspects. Different people have different aspects. Yes, you have, if you want to clean the teeth, at least 2 minutes, approximately.
At least 2 minutes.
At least 2 minutes. You should clean every teeth from all surfaces, outside, inside, and also in round movement. Some people use straight movement. That's wrong, completely wrong. It destroys the gingiva, it causes erosion of the occlusal area, especially of the teeth. So always do gently around movement. All the teeth from outside, from inside.
Circular motion. Circular motion.
Yes, circular brushing, exactly. That's about the brushing. And another way to keep also oral hygiene, it is, and this thing, most of people don't realize the importance of that. It is dental flossing. Dental flossing, the only way to clean interdental area, the area between dent, and about, in my practice, 80% of caries comes from interdental area, this area, 80% of caries. Because most of people, they just brushing, they don't use dental floss. Dental floss, it is main thing. Once a daily, it is enough. You use, I advise all to use free dental floss. That's without holder.
Yeah.
It is come on roll, you can use it. use enough length.
What is the difference between the one with the holder and with the free string?
Yes, the material is same. Both are same materials.
Yeah.
But the holder, it is short. You can see it is very short. So when you use it, it will get dirty. You have to replace for every teeth. No, it is not reasonable to change that every teeth. So use a big roll, hold it in your middle finger, clean first area, then move it a little to clean part of the floss, clean another area, and like that. So you can use. You will not use the dirty place on another area again.
Oh, okay. So try to keep moving the thread as well while you're flossing your teeth, so you do not use the dirty end at a clean place.
Yes, because it is the main purpose. It is cleaning the area. If I use a dirty debris, bacteria will go to another area. So no advantage of using a dirty part of floss. It is cleaning debris and cleaning bacteria.
Right. Now, you said that there are dental flosses, the one with the holder, the one which looks like a C shape, with a toothpick kind of prick at the end. And this has a small thread in between of it. This is one kind of dental floss, and the other kind of dental floss is the one by the meters that comes in a small roll.
Yes, yes.
And there's another third type of the dental floss that is very commonly available nowadays in the market, which looks like a slim vertical brush. It's a very thin, tiny brush.
Yes,
it looks like the kind of a brush that people use usually to clean glasses or to clean milk bottles for the babies.
Yes, exactly, but in a small micro shape.
Yeah, it's very small.
Yes.
So now those usually, when people are using them, they use just one at a time, and they use the same to clean all the teeth.
Okay, that's a very good question. This should you use, this is different from personal. If you have too much bridges, too much crowns, then you have to use this is called interproximal brush. Interproximal brush. Because floss, it is about its diameter less than 1 micron, about microns. It is less than 1 millimeter. But this brush, it is about 2 millimeter diameter. It does not fit in normal people interproximal area. You can't put a brush inside. But if there is gingival recession, or if there is a bridge, if there is implants, you have this area big, so there's a lot of debris. You use first that micro brush or interdental brush. You can use it. It is good also. It is one of oral hygiene tools also. We can use it for oral hygiene.
Right.
One more thing I want also to mention that it is to use a mouth rinse. Also, it is essential to use mouth rinse daily.
And why is it so essential?
It is, the main reason of dental cavities is bacteria and food debris. They join together, they make that demineralization of teeth and cause caries and decay inside tooth. So when you use mouth, after you're brushing, you clean your tooth, you need something to clean the debris. You get debris out. Some of them you see, you can wash by water, but some of them maybe still inside your tissue, gingival tissue, or inside between teeth. So you use the mouth rinse, you thoroughly between tooth. It's go anywhere you can. So that is the reason.
So tell us one by one. First, should you brush your teeth first, or should you floss your teeth first?
First, always brushing.
Always brushing.
Always, it is brushing. Suppose that you're brushing twice daily, morning or evening, you can do flossing after you're brushing.
And then comes the final rinse, which is going to be the mouth.
Final rinse, yes. It is rinse. I consider it optional. If you have too much problems, you have too much gingival, especially problems, you strongly advise to use mouth rinse.
Right. Now, Dr. Muhannad, we are always confused as television presenters every time a new dentist is sitting on the chair that you are. Now, some of them say one thing, some of them say other things. Now, all of them talk about oral hygiene, but each one has a different approach of how to maintain oral hygiene. Like in one of the previous editions, a dentist who was joining us said that you should buy a big bottle of mouthwash. And once you finish this bottle of mouthwash, do not use a mouthwash for 2 months. Then buy a new brand of mouthwash. Do not buy the same one. So every time you buy a big bottle of mouthwash, you should use the whole of it and then discontinue using any mouthwash for 2 months and then start using it again.
That is, yes, good suggestion. This is good
This is a
suggestion,
good
this one.
suggestion.
Yes, yes. That's in US. There is a, you find a big bottle of mouthwash. Here, I think I didn't see here in markets
Yeah.
and in pharmacy. I didn't
I think
see
the
that.
biggest we get
But
like to this
yeah,
big,
the biggest here we can maybe 500 milli. That's the biggest. But there you find 3
Yeah.
liters sometimes. It's
Yeah.
huge. That's good idea to change mouthwash. It is like changing. Also, we advise to change dentifrice, the toothpaste.
Toothpaste,
We
yeah.
just also suggest to change it every while. That's a good idea, and I support that. But it is not essential. Just use them, any
No,
kind.
but what this particular dentist said was to use your mouthwash, and when you finish the whole bottle, whatever is the size of the bottle, do not use any mouthwash for 2 months, and then buy a new brand, and then start using.
Maybe that's because you know, if you use for 2 months, I just usually use it belong to tip. What is tip of mouthwash you are using? There is some of them for therapy. They contain medical agents like antibiotics. It contains some for them just for cleaning.
Okay,
General
now we
antiseptic.
have the regular mouthwashes that the toothpaste company people make. And then we have Listerine mouthwash. Which one is it that people should be using? The one which has Listerine in it or the standard one?
Which one?
We have all the different kind of mouthwashes,
Yes.
like some are mint flavored, strawberry
Yes.
flavor, whatever flavors are
Yes.
there, which the toothpaste companies make. And then there are the different types that you can get from the pharmacies, which they say is the one with Listerine in it.
Yes.
Now,
That's-
which one is it that is?
Yeah. To use, I advise to use actually some from pharmacy. You find both also, but in pharmacy usually that's used only if your dentist prescribes that. For the one in supermarket, it is for daily use. You can use it in any cases, any circumstances. But if you have a problem, you have gingivitis, suppose you have gingivitis, you have ulcers, you have any kind of a problem, on oral problem, on tongue, then we specify some medical kind of mouthwashes, and usually we tell patient use for 1 week or use for 5 days. Some kind of mouthwash you should not use more than 1 week.
And what are these kinds of mouthwashes?
Other kind?
Yeah, what is this kind that you should not use more than 1 week?
Chlorhexidine-based mouthwash. Why?
Chlorhexidine. Chlorhexidine-based
Chlorhexidine-based mouthwash.
Uh-huh.
This will cause teeth pigmentation if they are using for very long time and continuous use.
Uh-huh.
Right. Now, with this, Dr. Muhannad, we would also like to know about, we already spoke about mouthwash. We also spoke about toothbrush, that it should not be a hard one. Now, if we can possibly talk a little bit about the time of brushing. Many people, what they do is they would, because the dentists say we should be brushing twice a day, they would brush once in the morning and then once after lunch, and that's just about it. What is perhaps the prescribed time for us to be brushing those 2 times in a day?
Actually, 2 times, it is minimum. It is enough, but that's minimum required. I advise after every main meal, that's mean use brushing. Brush your teeth after every main meal. That's been 3 times every day. Most of us, most of people, normally they have 3 meals. After every meal, brush your teeth. That's what I advise.
Okay, now normally we said that we should be brushing for at least 2 minutes. Should this be the 2 minutes when we wake up in the morning, or we should do it for 2 minutes every time we brush?
Minimum 2 minutes. Actually, that is the brushing technique more important than time. The brushing technique itself, it is more important. Suppose that I have a good skill in brushing, I finish my brushing 1 minute maybe. The other people, they don't have skill. They take time while they looking for this teeth from inside. Maybe they spend 5 minutes. So it is not about time. It is about brushing technique. Use the good technique. You can search internet. You can surf internet. There is a lot of video on YouTube that describe the correct way of brushing teeth. I advise again, do it gently, do it thoroughly, do it every day. That's the main things.
Right. Now, Dr. Muhannad, also talk to us about young children. We see that once a child has the first tooth is when most of the dentists like yourself say, bring the child to us so we can assess the tooth and start cleaning the tooth from the first time that you see a tooth. You should start cleaning it so the baby gets used to it. Now, once a child has a mouthful of teeth, how important it is for the mothers to be brushing the children's teeth?
How age? It's depend of age of a child.
What age should the mother start?
She should start to do it by herself. She does it by herself. About, we advise age 2 years old. The mother should start brushing her child teeth. After that, the most important thing, make it a habit. So tell your child always, did you brush your teeth? He said no, go brush it. If it's become a habit, that will help him when he grow, it will be a habit. Like washing with water, washing face with water, it will be a habit. So every time he wake up, he have his lunch, he has his dinner, he will brush his teeth. That is the most important thing. Make it a habit for your baby.
Right. Now, doctor, speaking about a habit, most of the people, they have the habit as soon as they wake up in the morning, they will go wash their face and they would brush their teeth. But then when they have breakfast, after having breakfast, they don't brush their teeth again. Is it a wrong practice or is it something that can be overlooked?
Actually, he is brushing. I can't say it is wrong. It is wrong practice, but it is not a preferable practice. I prefer he do it after breakfast.
Oh, so when you wake up in the morning, don't brush your teeth?
Brush, but after breakfast. If you have breakfast, some people, they don't have breakfast. Okay, you can brush. It is good that you are brushing, but it is better to do it after breakfast.
Okay, so let's say if a person brushes, like I brush my teeth when I'm going to sleep. Now, when I wake up in the morning, can I have breakfast and tea before brushing my teeth?
Yes, of course. You can do that.
So I can do that, and then after I finish breakfast, to brush my teeth.
Yeah, that's better.
So breakfast in bed is not so bad. Because a lot of the people, they have breakfast in bed.
It is not so bad.
And I would always look at people and I would not understand really that why is it that anybody would want to have breakfast in bed without having to brush their teeth first, because this is actually the whole concept of having breakfast in bed. Because
you can do it. You can do breakfast
so now
in
your
bed.
mouth, let's say, after having 8 hours of sleep, as they say, that the saliva is the protector for our teeth. So we have so much of saliva in our mouth when we are going to sleep, and because, you know, the germs and the bacteria which is maybe already in the mouth, even after we have brushed our teeth, flossed our teeth and used the mouthwash and we go to sleep, now moisture is the most ideal habitat for all that bacteria to really flourish. So all that is in our mouth when we wake up after 7 or 8 hours of sleep. But nonetheless, we can go and have breakfast and tea without brushing.
Actually, no problem. You can have breakfast without brush. You know that the most important, why we are brushing? That's the question we ask. Why you are brushing? We are brushing to clean food debris, to kill bacteria. We don't kill all bacteria, but a little, reduce the power of bacteria. That's better than killing bacteria. And so that is the reason we are brushing. So suppose you have two choices. Brush before you breakfast, and the other choice is to brush after breakfast. We will check what's more dangerous, to brush before breakfast. If from my ideas and my point of view, it is more dangerous to brush before breakfast, because what will damage the tooth more? You sleep, your teeth clean, no food debris. You're supposed to do flossing. You're supposed to brush your teeth, use mouthwash. Then you sleep. So your teeth, it is a normal situation, no food debris. Saliva, it is normal. It is from our nature. It is normal. You are in normal sleep. But after you have a breakfast, you will keep food debris for 4 or 5 hours inside your mouth. That will damage the tooth. That's what will damage the tooth. Especially if you have most of breakfast contain sugars. It contains sugar, it contains starch, and they are these, as you know, they are enemy of tooth structures.
Right. Now, Dr. Muhannad, tell me another thing is that some of the people, as our viewers have written to us as well, they say that when they wake up in the morning, sometimes they feel that they are having a major bad breath and they have to be brushing their teeth before having breakfast or even having their cup of coffee because they are disgusted with the bad breath they have. And some people have written that there are some days when they wake up with bad breath and there are some times that they wake up feeling very fresh in the mouth. What is the reason for it?
They have bad breath.
Some people, like as our viewers have sent questions to us with the previous session that we have had with our dentist in the program, some of our viewers have written to us, actually two of our ladies who watch us, they said, well, some of the days when they sleep at night and they wake up in the morning, their breath is good and normal. They don't feel bad. But there are some days when they wake up that they have to brush their teeth before breakfast because they feel very bad and they feel a very bad breath. What is the reason for it?
Yes, understood. That's the reason, actually. And they are brushing their teeth before breakfast for this reason. That's right. Many of people, they fall bad breath. But the reason of bad breath, actually, there is many reasons for bad breath. I can't identify before I check and I know the history, so I can identify. But, you know, dental caries, dental cavities, they cause gingivitis, and especially periodontal diseases. They are the main reason for bad breath. Some kind of, you know, some systemic disease like diabetics, like kidney failures, also they have bad breath. So there is many reasons, but the main reason is infrequent toothbrushing. That is the main reason for bad breath. Some people, you know, they sleep, maybe these days they feel bad breath, they didn't brush before they sleep. That is the reason. So food deprivation. Also dry mouth. That is this disease. A lot of people, they don't really realize that they have a dry mouth. A lot of people. But if you have dry mouth, you sleep, your mouth getting dry, bacteria more, and you know that infection and start happen fast because saliva itself. It contains antibiotics. It contains some hormones, some of materials that prevent caries and also save our tooth structure and gingiva. So when you have a dry mouth, there is no saliva. So bacteria, they can play, they do whatever they want. So you wake up at the morning, you feel there is a bad breath. You run to brush your teeth. That's the reason. You are completely right. That's the reason. Most of people, they wake up, they feel, they test their breath, it is bad. So I have to brush my teeth.
Yeah. Right. So if you're waking up with bad breath, that means either your brushing technique before you go to bed is not very good, and you need to spend more time brushing your teeth and be more careful with flossing and using the mouth rinse. And even if after that, after brushing properly before bedtime, flossing and using a mouth rinse, still if you wake up in the morning with bad breath, you should consult your dentist.
Yes, of course,
to find out what is the reason behind it.
Yeah, it should be a reason. It should be a reason.
So either your dentist is going to address this problem with dental caries or tooth decay or anything by himself, or would refer you to another doctor,
yeah, to another
internal medicine.
If he try all what he has, there is no solution, he has to try to transfer to another doctor to check for other problems. Maybe there is systemic problem.
Yeah. So by no means a healthy person with healthy teeth should have bad breath early in the morning after brushing their teeth the night before.
Should have?
They should not have. A person who is healthy?
Yes, but 90% I think they will not have.
90% you should not. So if you are having repeatedly bad breath, especially after brushing your teeth properly before bedtime, in the morning you still feel bad breath, then you have to be remembering the fact that either start brushing more properly and flossing your teeth and then using a mouth rinse before going to bed, and carefully watch the pattern. If still repeatedly you seem to have bad breath, go and talk to your dentist so that the dentist would be able to realize the problem and treat the problem, or else if nothing else works, then he's going to refer you to an internal medicine doctor so that he would be able to help you if you're having any stomach disorders or kidney problems or any of the other kind of a complication. But anyways, with this, we are going to be thanking Dr. Muhannad Abdulhafiz very much for joining us in today's edition of the program. Dr. Muhannad, thank you very, very much.
Thank you.
And for any questions from our viewers, we will send them to you through email.
Thank you very much.
And well, for all our viewers who watched the discussion for the day, If you have any questions from Dr. Muhannad Abdulhafiz, you could send them to us on goodmorningksa@gmail.com. Once again, I repeat, our email address is goodmorningksa@gmail.com. For the moment, we are moving on towards our next break, after which we'll be joining you back again, so stay tuned.